Today's episode is sponsored by Seed. Their signature product, the DS-01 Daily Symbiotic, is a combination of clinically researched and science-backed probiotic strains and prebiotics that work together in synergy to promote healthy digestion, ease of bloating, glowing skin, and more. You can check Seed out and try the Daily Symbiotic yourself at seed.com. You can use my code AaronJudge15 for 15% off your first month supply. Welcome back to The Gut Show. Today you are in for a treat because we have a special guest, Shana Spence. Shana is a registered dietitian nutritionist based out of New York, but you can find her online at The Nutrition Tea, spreading the word about non-diet approaches to healthcare, as well as the health at every size movement. She is such a trailblazer in our field. And in this episode, we're talking a little bit more about what health at every size means, what to do if weight has been the central focus and approach in your healthcare and your health plans, just how to advocate for yourself for more high quality care and get involved in this movement in order to have more inclusive and quality care overall for our entire population. So enjoy today's episode, connect with Shana afterwards through social media, and then connect with us in the Gut community to share your thoughts, questions, and dive deeper into the conversation. Hey, Shana, thank you so much for coming on to the show today. I want to get started by just learning more about you. So tell me a little bit about yourself and why you decided to get into nutrition and, the disordered eating path.
So I began my career actually in fashion. So I used to work in that industry for about 8 to 9 years. And then I switched over to nutrition. I became just super interested in public policy and the public health side, especially here in New York. And so that was kind of my goal going in, just learning about the disparities and kind of how to deal with that. And then, I went to school, did the whole thing of taking the exam and, internship and all that. And I actually now currently work for a Department of Health, but I didn't get into the anti-diet haze, disordered eating. That came after kind of learning about that aspect, really through social media. I know we always complain about social media, but I think sometimes it's just a really great learning tool as well. And that's sort of where I became interested in that sort of aspect. So it's kind of nice to combine both worlds. And yeah, that's kind of how I got started.
That's awesome. I had no idea. So I met you through social media and had no idea that you had a background in fashion, or that was the route that you came, which is such an interesting overlap of how that happened.
Oh, totally.
Was it through your work in fashion that you became aware of disparities? Was it because of the area that you lived in, or what really connected that and brought that connection to the forefront?
It was more so the area that I just grew up in, and that kind of, I was just reading, you kind of hear about things, and, in fashion, it's fine. It's a fine industry for some, but, I was kind of getting the feeling I wasn't contributing much. It wasn't for me really. And I have friends who still work there. So it's not the industry, it's just the individual. 'Cause it is very, it's intense. I'll just put it that way. So, but then I just started noticing different things happening in the area I grew up in, and then kind of moving back to that area. Because there's a lot of, yes, across the country, but definitely in New York, I don't think people realize how much of a discrepancy there is, just because I think New York has the reputation of being this melting pot of diversity, which it is, but I don't think people realize there's so much discrepancy between folks. So that just was an interesting thing for me. And so now working with Department of Health, kind of just figuring things out, has given more insight for sure.
That's awesome. And you grew up in New York?
Yes, I'm from Brooklyn.
Okay. Wow. That's interesting. I'm from a small town in South Arkansas. So pretty much the opposite of New York City.
Yeah.
Very small, 1,000 people, probably one little tiny street in New York. But also it's interesting to see the health discrepancies there, and just how discrepancies within health, and I worked in public health too, but how that's so unique in that it can be present in New York City, where people are commuting more and like there might be more of a population in a small area. And, there may actually be a grocery store, but that doesn't necessarily mean that there's still not a discrepancy present. And then you look at places like where I grew up, like very rural, small town where there's not a grocery store present and like you have to drive a long way. There's no commuting, right? You drive everywhere. You don't walk anywhere because you would never be able to get to your job or where you're going, but it's still present in all of those different places. And
totally,
it's interesting to think about that. And so now you speak a lot on the health at every size approach. You speak on the anti-diet piece. And you mentioned that came up through social media. How does that actually influence your work now in the health department? Like, is that something that you find is at the core of some of the work that you're doing and some of those problems you're trying to solve, or just kind of where is that connecting now?
It's hard because I try as much to kind of intersect the two, but when you work for the city and state, government, just put it that way, it's a little bit hard because we definitely do a lot of focus on like BMI and that sort of thing. So it's not the easiest. Like I can't just say, well, I'm not going to do that, but I can. Luckily, I do have a supervisor who is open to hearing those things. So it really, there's not much room to kind of do your own thing. But at the same time, I'm lucky to have a supervisor who's like, yes, we can try to see if we can like do things differently. Just because what I do is a lot of community work, going into different communities and talking about nutrition, of course. But now I was kind of given the go ahead, like, yeah, we don't have to kind of emphasize like all those O words like obesity and, all of that. We can try to focus on the actual nutrition, which has been nice. But like I said, it's very individual. Like not everyone can do that. Just want to put it out there.
No, I get it. Yeah. I don't think, and then we'll get into like the whole diet culture and all this piece, because it is so deeply rooted in our society and in our culture. And I think what a lot of people don't understand is that it is so deep in our government and in the research that's done. And I used to work for the WIC program. We had to take weight, we had to take BMI, we had to track weight. And if a child was gaining too much weight, like there were certain educations we had to give, and it was all required in order for our families, to get their text or their card. They had to go through all of that. And you can see it when you're inside of it, how it's a problem. And then it also feels like, well, am I perpetuating this and making it worse? And then how do I, do that and fulfill that need, because it's needed for the research and the outcomes, and all of that stuff, because we haven't gotten creative yet, but it's also not the main focus or the value versus like nutrient quality and, quality of life and other resources and so many other things that mattered more than whether a kid has gained a certain amount of weight.
Exactly. There's so many other detriments, right? Like the social detriments. And, I think it would be more plausible to focus on those things, but, we do what we can, so.
And thankfully, I think it is starting to change because voices like yours are there. And that is the way that things change. And we'll definitely get into that because I do think there's some pieces to all of this that there's some personal tools that, listeners, we can use if we're experiencing some of the language we're going to talk about. But there's also things just as a population, and as a human race that we can all do, whether we experience it personally or not, that we can do to help try to change what's going on. And if you have those resources, we'll talk through those. But I think it will help because the whole idea of health at every size, anti-diet, anti-weight focused healthcare is something that's a bit confusing to people on social media. There's so many sides to it that, when we break it down, it makes sense. But then there's also so many voices that are against it or just completely misunderstanding it. So I'd love for you to break down what health at every size actually means and why it's so important that we start moving towards that approach.
Yes, there's so much confusion. And it's kind of interesting because like you said, I think there's so many sides to it where there are folks who will say, yeah, no, I don't want people to be stigmatized, but they'll use stigmatizing language. So I think it's actually important to start there. With health at every size, the whole purpose is that we're saying that it's not okay to stigmatize a group of people, which, I mean, on paper, it's like, yes. But for some reason, it's kind of accepted to have these like clinics of like diagnosing people, like, why do you look this way? It's just like, okay, that's not okay. So I think that's a good place to start. And also, health at every size is really just taking a non-weight centric approach, meaning that we can actually provide nutrition intervention, nutrition therapy, or any sort of health related things that someone needs without focusing on the scale or without focusing on numbers in general. It's possible to help someone who is diagnosed with diabetes or like IBS or, anything like that. But you don't have to constantly weigh someone. You can focus on health behaviors, such as eating, how they're sleeping, all of these things. So I think it's just like a super important movement, in my opinion, because telling someone constantly, well, you need to lose weight, that's not helpful, because we know that folks of all sizes have diabetes and, IBS or, heart disease. So why are we focusing on weight with certain populations? So I think that's the general gist of it. But I think the stigmatizing language is the part that a lot of people leave out. Because I do notice that whenever I hear of obesity doctors talking, they're like, yeah, no, we want to make everyone feel like not stigmatized, but they're calling themselves obesity like doctors, or so it's just like, okay, you can't do both. Yeah. So that's the thing I think that most people don't realize.
Yeah. Oh, that's helpful. It's helpful to break that down and see that. And I think one misconception that I've seen just in hearing people talk about it, and I think that we are technically health at every size practitioners. We don't consider ourselves like certified health at every size practitioners.
Right.
On weight. Honestly, I've never wanted to. It's like, to me, it just doesn't make sense of like, well, okay, fine. Like, obviously if you're rapidly losing or rapidly gaining, it's not about the weight in that point either. It's about what's going on in your body, like what
exactly
you're communicating, and that's important. But just focusing on weight doesn't actually provide value versus all of the other pieces of information that we can get. But what are some of those stigmatizing language pieces that you see, especially among providers, but even among people who are living with conditions that they might take on and use themselves and maybe, on social media and things like that? What are some of those examples?
I think just, and that's why I call them like the O words, because for a lot of people, they're very triggering, but, we see them a lot, even as kids. Like I remember taking those health classes in, elementary, or maybe was it elementary? I can't remember, but, that's when you first start hearing about those things. That's when you start learning about being quote unquote a normal weight and being quote unquote overweight, and that alone, it's sort of dehumanizing, right? Because you're labeling a group of people as normal. Like, think about that. Like, these are normal people, and all these other little groups are not normal. Like, that's not okay. And it's just something that I don't think a lot of people realize, because it's something that's been ingrained since we were younger. Because everyone, even if you're not a health professional, you know what BMI is, because it's something that's taught now. But it's just that sort of language of being, okay, so you're not normal, so we're going to categorize you as overweight. And it's like, over what weight? Like, what over, like, why is this considered normal? And I even forgot to add that BMI, to get into like a brief history, it's kind of amazing that it was like formulated back in the 1800s, right? By a mathematician, had nothing to do with health, was not supposed to be used on an individual basis, and it was only used on white men. So that alone tells us that we maybe shouldn't be using it today, but of course we are. And also, it was the weights were changed when a lot of the drug companies, like, right, for the obesity, as much as I hate saying those words, like weight loss drugs, all of those things, that's when it started becoming more popular. So they changed a lot of the BMI. So folks that were in the normal, quote unquote, normal category all of a sudden found themselves overweight, so it's just like, why did this happen? And, no matter what their labs are, no matter what, anything is going on, all of a sudden they're categorized as not normal, so that's sort of, it's just problematic, so that's what I know. I just went on a rampage, but it's very like stigmatizing to really be told you're not normal, when one category is normal and everything else isn't. Like, come on.
Yeah.
So
yeah, to perpetuate some, like, I mean, mental health, right? Especially now
exactly.
with social media, with media in general, and media whenever we grew up. I think a lot of times we always talk about social media now, and I'm assuming we're close to the same age. We may not be, but social media now. Whenever I grew up, we didn't have social media. We didn't have
me neither.
right?
Yeah, totally.
I grew up in the golden era of growing up to develop a use of internet and social media in high school. But I still grew up when women were like just completely torn apart, right? The age of,
oh my God, those magazines.
Yeah. And you look at how women were treated, and even men. I mean, just the way that we talked about people, and it was like the age of tearing apart celebrities, like the paparazzi kind of age. And it was all focused on weight. It was always about like how thin you could be, or how clothes were only made for certain groups of people and only made to look one way. And if it didn't work for you, like you were the problem. And then social media came on. And so when you're thinking about this whole, like, you're normal or you're not, it goes beyond just, oh, I'm either normal weight or I'm not. Like, there's so much mess in the brain, in our brains.
100%.
That can lead you down a path, right? And then if you're told, by a healthcare provider too, of like, oh, well, this is what you just need to do, or this is your problem, that's just going to perpetuate that. And, for populations like those who are dealing with chronic illness, and especially GI conditions where there's so much mystery, you already feel abnormal. Then to hear something like that, that's even more damaging. So I want to talk about that part of it, of the damage that's actually done. So yes, there's some stigmatizing going on, right? And that's damaging. The mental health piece is damaging. But there's also this other component of it, of healthcare and quality healthcare, as well as, I dare to say, unethical healthcare, I guess is a good way of saying it, that comes from this focus on weight. So I'd love for you to talk a little bit about that, about beyond the human aspect, which is also important. There's also this system problem within our healthcare that is not serving communities correctly because of this focus on weight. So can you hit on that a little bit?
Definitely. And, it's not really a surprise, like, because I'm pretty recent dietitian. And so I remember being in school. I mean, I'm sure we all do, right? And we're learning these things and we're jotting it down like it's a normal thing, because you're in like a health science field. And so it's not really a surprise that a lot of doctors or nurses or dietitians, other dietitians, view it like this, because that's what we learned. So it's really kind of interesting, because it doesn't quite make sense when, like, this is how I look at it, where if you have two sets of people coming in and they both have the same issues going on, why is one written off as, just lose weight and everything will be okay? And the other one is like, oh, let's do some tests. Let's figure out what's going on. I'm going to write you a referral to X, Y, and Z. So, and I think I don't even have to say like which group is, which, right? Obviously the person in a larger body is being told just lose weight and everything will be fine, So I think that's a problem, because I've seen it so many times on social media, even a couple of my clients who are in like larger bodies, and they'll come back and they'll say, okay, finally got a diagnosis and it was this. And they were just like, no one was taking me seriously. I was just told to lose weight. And now I have this problem that could have been fixed if I was just given like a normal diagnosis or referral. So that alone is, in my opinion, kind of unethical, like you said, because we're like, why is, the same thing, the same presentation of the same symptoms, why is one group being cared for more than the other, So that's a big problem. And, I think I hear an argument a lot of, Well, when we look at different illnesses or different diseases, what have you, we notice that there is this like correlation, right? Like, I'm not going to say causation, correlation of folks in like larger bodies. And so I always answer to that. I'm like, if you are constantly being told that you're not normal, that if you go to the doctor and you're constantly just disregarded, that you're looked down upon, you're not going to go to the doctor. You're not going to go and get, and do that preventative care. You're not going to, like, why would you want to feel stigmatized? So folks probably aren't going to the doctor and getting preventative care. Or we're looking at other contributing factors like, access to food, access to clean water, all of these other things, that we don't think about. So it's not just, yeah, well, these people, that's how I hear things. That's not me, where people are like, well, like there is a correlation. And I'm just like, okay, you have to look at it a little further. It takes some critical thinking.
Yeah.
Sometimes I think especially with the health field, we're so used to things being by the book that we don't like, it's very hard to look past that. It's like, okay, but if you know that someone is going to look down on you or someone's going to stigmatize you, why would you go to the doctor? So
yeah,
lots to unpack there.
yeah, which is common sense. It's like, well,
yeah,
what else is like, and I love the maps where they show, yes, like, weights might be higher in this area, that then we also see an increase of this condition, but also access to food is less, or
exactly.
the poverty levels are higher, or there's other things that are going on that we're not taking into account. And like you mentioned, if all you're being told is to lose weight, but you're not actually being given tools to truly manage your condition. And we can use someone with diabetes for an example. If you're just being told to lose weight, some of the actions that you might take to lose weight could actually further do damage with diabetes.
Exactly.
Right. Like skipping meals and, not eating or severe restriction, like that's actually going to worsen the diabetes. So of course, those conditions might be higher from the actions that people are doing because they haven't been given valuable tools, which is, something within the GI world I'm really passionate about is not giving tools for patients, because if they don't have the tools, like we can't expect people to improve. And so just telling someone
exactly
to lose weight, or just telling someone to exercise more, eat healthy, or whatever it might be, that's a blanket recommendation. If they don't have actual tools, like how in the world are they meant to try to manage a condition or feel better, especially because health is going to look different for them too. And if they're trying to mimic, this person online, like it's just not going to look that way. And that can be really frustrating. And I see it sometimes in practice. I see two sides of it. And I'd like to talk about this a little bit, because I think we focus a lot on, health at every size. Like, oh, well, it only impacts, like, it only looks like this one way of you need to lose weight. Right. But there's also another side of it where, because we have such an idea, like the healthcare world, not me, but, we have an idea in the healthcare world that those in larger bodies are more at risk for conditions. Sometimes I think those who are in the quote unquote normal range, or even those who are in a smaller body, right, who are, or have lost a lot of weight, I see this often, are disregarded. Because, or even if they're still in a larger body, but they've lost a ton of weight because of something that's going on,
they're congratulated.
Not looked at, right? And I see that so often with GI, where I've seen the side of, people talking to me and crying because their doctors refuse to talk to them because they have, these extreme like gut pains and concerns, and all they're told is like, oh, it's because of your weight, which when we look at like the pathophysiology of IBS and, certain conditions, like that has nothing to do, like there's nothing to do with it. There's only one that weight does maybe have an impact on, but it's only one small characteristic. That there are also so many other tools that can be given, that just focusing on that one thing is not going to actually solve the problem. And so, we don't even see that connection, but I still can see a lot of patients being told like, okay, well, you need to lose weight. We're not going to do further testing. And that just makes someone feel like it's all in their head or made up. I've also seen, providers tell patients that like, oh, you've lost weight. That's a good thing. Congratulations.
Yeah.
That's a positive. And then you look deeper and it's like, they're not eating anything because food is causing them a lot of pain, and then they're scared of food, or now they've developed like these really intense disordered behaviors that they're being celebrated for, that are just leading them down a path where their gut is not functioning like it needs to. And then I've even seen those who have lost a lot of weight or who are avoiding food. And there's a lot of, layers to that, but they're being told like, oh, well, you look fine. Right. Which inherently comes down to body weight, because I've pretty much never heard someone in a larger body tell me that they've been told they look fine. And I've seen those in smaller bodies who don't actually look fine, or the skin is pale, their hair is brittle. It's like there are signs that we learn in school, like what to assess. They don't look fine, but they're told that they do. So I'd like for you to talk on that a little bit as well, because I think there are some nuances to this that if someone's listening, they're like, oh, well, I've never been told to lose weight. It's like, this could still be impacting you, and it's impacting your neighbors, your brothers, your sisters, like all of the human beings around you. But yeah, I'd love to hear your thoughts on that piece.
Definitely. I think, health at every size is really health at every size. So it's not just meant for, because that's another misconception. It's not just larger bodies. It's literally every size. So, I just want to make that clear too, because I get that question a lot, and I forgot to touch on that. So I'm glad that we're bringing it up now, because folks who are just maybe thinner, right? And so the same rule applies, where we're not going to keep focusing on weight, but we're going to focus on what's actually going on. So someone, like you said, who goes to the doctor and they're on they're on the thinner side, and they're constantly losing weight, even still, doctors are like, well, that's not a bad thing. Like, because we always just uphold this idea of like the thin ideal. And, even looking at, there was this study that I don't know if in social media world, because of course I can't remember their exact name right now, but that Dr. UK is the handle. And they posted this study where it shows how people who are quote unquote in the overweight category are actually have better health outcomes, because your body is actually protecting you, right? Like, so that's why it's kind of mind boggling too. Like when folks are constantly losing weight and losing that protectiveness, I'm overgeneralizing here. Those aren't like health terms, but with the protection of your body, I think that that's something that's not looked at enough, because they're just like, well, everyone can lose a few pounds, right? Like that's how we think of it, unless someone actually presents as sickly or has a quote unquote anorexic look. I think that's the only time where it's called out on. And let me just say, folks of any body size can have anorexia too, because it's not just your physical appearance. So I think there's just a lot of misconceptions and a lot of, and I'm not saying this is every doctor for sure, but it's just that I think for the most part, sometimes it's just easier to think about what you learned in school in that textbook and just forget about things or just write things off. And I know how the healthcare system, like working in a hospital, doing clinical, I know it's a lot, right? So sometimes it's hard to really have that one-on-one with a patient, but you really have to think about it. If someone's losing weight like rapidly, or if someone is, or whatever change is happening, really think like, okay, maybe to you, they look quote unquote fine, but is that really okay? Like, think about it. Like no one, what's really going on here? So I think that just happens too much of people of any size, really. It's just like, okay, well, you're still thin, so it's okay. It's like, no, it's not.
Yeah, absolutely. And I think the big thing is, right, changing the lens of what we're looking at people through and health at every size is saying, instead of weight and size being the main lens, it's one piece of data that we have and we might use. It's not the picture, and it's not the lens with which we should look at people through. And the lens really is what listening to people and actually
exactly
talking to them. That's a big one. And I know that's changing. I know that there are different things that are being trained, and you see it in even some younger professionals. Like we are seeing things change, and it's a positive, but it's not fully there yet. And I think it's going to take a while for that lens to fully
100%.
and you don't always know going in, right? You don't always know going into a doctor who's going to have what lens on. And sometimes it can be hard as the person going in to know, well, what am I stepping into? And like, are they looking at me with this lens, or are they actually, evaluating more? And then if you feel degraded because you're told something, it's hard to also see that, wait, no, that's wrong. So I like to talk through some tools, right? If someone has experienced this in the past, or maybe they haven't experienced this personally, but now their eyes are being open to, I actually might be like, my healthcare might be influenced by this problem. What are some tools that they can use in their visits or finding a new provider, anything to move forward and get the healthcare that they do deserve?
I think that it's Reagan. I think Reagan Chastain. She's another one who, or they're another one on social media, came up with a really great tool. It's the Hayes worksheets or it's worksheets where they came up with this for many different illnesses, or like diabetes, whatever you think is going on or whatever you might have. There are different ways to approach it with your doctor that you can present to them without it being focused on weight. And I think it's just really smart because unfortunately, we just have to be prepared in general, especially if you kind of already know what you're going to get from your doctor, the reaction rather. It's just really a good idea to kind of have your tools, your resources like ready to just present. And I think that's such a great resource. And the ASDA, like the Association for Science Diversity, they also have really great references on their website where it's providers that are Hayes. Unfortunately, not a huge amount, but in some ways it might be helpful to find doctors who actually are Hayes aligned. There's some out there. So it might be really helpful to have those resources, but really just being prepared. I think those Hayes sheets are really a great idea because oftentimes, even for anybody, right? Like when you're going to see a doctor, you're like, okay, these are really smart people, right? And, it's intimidating to be like, well, actually, I think this, it's intimidating because you think, so I get it. And that's why I think really arming yourself with those resources and just being prepared is just a really great idea for anyone, really. I think it's just a smart idea. So those are two that I always recommend.
Yeah, that's awesome. And I can link those. I'll look up those and find a link or something where we can put those.
Yeah, I'll email you. Yeah.
Anyone listening, if you need that resource. And then I think something else is, you don't have to be weighed. I think that's something that a lot of people don't know because you're funneled in, right? You go to the doctor, they take you to the weight. And there are, I think, some situations where you do, but you don't always have to be told your weight. And so if you are struggling with that, you can decline and you can also request not to not see your weight or be told your weight. And if they still do that, like it's important to stick up for yourself and say, actually, I requested that you not do that. And that's something a lot of people don't understand. So if you are concerned that will be the only focus, you can decline. That doesn't necessarily mean someone's not going to look at you and make a judgment. But if that happens, we also have to call that out because the only way the healthcare changes is if we make sure to say like, hey, that's not actually correct. Or hey, that's not very kind, or you can't make that assumption about me by looking at me, making sure to make those statements because we have to challenge the bias. And GI, I mean, we say that if someone, makes an assumption about you and it's not true. I've been told like, because my dad died of lung cancer, I get told like, oh, you must not smoke. It's like, you can't make that assumption. Right. So you can't make that assumption, or, oh, you must already do this, or with those with IBS, you must be stressed. It's like, you can't make that assumption. Like ask a question to learn more, but don't make an assumption. I think that's important. And then, if weight loss is recommended, you can also say, thank you for that recommendation. what other recommendations do you have? Or what are all of my other options? Like what other treatment options are there available? And if they say that's the only one, then I would say, okay, show me the research for that's the only thing.
Yeah, they cannot.
Yeah, it doesn't exist. And I know for sure with GI, it doesn't exist. Like I mentioned, there's only one. And honestly, it's posture. It's like how tight clothes are, which it has nothing to do with your size. Like it has to do with the clothes. And so there are other things, right? And so it's good to ask like, why is that a recommendation for me? And what are all of my other recommendations, or what other choices do I have? You know, what other professionals can I work with? Like getting more information. If someone can't answer that, then that's a good sign to find someone new, which is important. And then when we're thinking about trying to change this as a whole, so those are some tools for the person who is receiving some of that, can use to advocate for themselves, but putting the weight on everybody, metaphorical weight on everybody, of like how we can start to change that. Like, do you know of resources for that, or what does that actually look like?
It's hard, it's, I think like the website that, the ASDA one, and it's, of course, I can't think of the actual, it's like Association of Size Diversity, something else. I just call it ASDA. But that's just a really great resource, because they have everything listed on there. So where it comes down to research, also resources like doctors. And so it would really be helpful for someone in case, again, if you're wanting to look this up, or if you feel more comfortable taking this to your doctor, it would be such a great idea to have those things like kind of ready. Yeah.
Yeah. Awesome. And then also supporting the conversations, right?
Yeah, totally.
Yeah, like just because you haven't experienced this bias towards you, or you don't think that you have, or maybe you are in that quote unquote normal range and you believe that's better, or whatever your belief is there. Don't tear down the other side without listening first. I think that's important. And we think that with all chronic illness, right? Just because maybe IBS doesn't look one way for you, that it is for someone else. Or I've had a conversation with my friend Christine from my IBS Life on here. One thing we talked about is you also like don't have a right to judge someone for doing something that might perpetuate their symptoms. So it's like the same thing where like you have no right to judge somebody or make assumptions about somebody. And so whether you believe it or not, whatever you're thinking, challenge that yourself, but also be cautious and careful and responsible with your words. And I think that's a way that it does change, right? Whenever we don't have people spewing their thoughts everywhere.
And that just happens all the time.
Yeah, I know. I don't know if it'll ever fully change, but I will never stop saying it because it's important. And, it's like, there's a way to listen to people and not agree with them, or listen and, be open to learning without changing every belief you've ever had. Like there are ways of listening. And I think this is a conversation that does need that, and is sometimes missed because it seems like such a neutral conversation, right? Where it's like, oh, well, whatever with weight. And it's like, no, this is actually bigger than that. And it's important to listen and know that you can be Haze aligned without necessarily like completely disregarding research. Like it's better to rethink things. And so just that's a little challenge. But anything else you want to share on that? Or, for those who are listening and dealing with chronic illness and just kind of navigating all of this? If you know me, you know that I do not mess around with the health of my microbiome. When I decided to choose a probiotic, I chose Seed Daily Symbiotic because it is backed by research and science, meaning I can trust and be confident in what I am taking. The probiotic strains found in the Daily Symbiotic have been shown to support digestive health, gut barrier integrity, gut immune function, cardiovascular health, skin health, and the synthesis of important micronutrients. And what's even better is that it has been tested to survive. Most probiotics are too fragile to survive the GI tract, but Seed has been Shime tested for 100% deliverability to your colon. This is all thanks to their capsule in capsule ViaCap technology. You can learn more about Seed and the Daily Synbiotic at seed.com, and you can use my code AaronJudge15 for 15% off your first month's supply. Now let's get back to the episode.
Yeah, it's just hard. Like, I think that every single time I have these conversations or I post something, I always try to imply that it's easier said than done, right? Like, everything we're saying is like sounds a lot easier. And, so I get it whenever, you still, even if you go like armed with all of these things ready, it's still going to be not the easiest thing to deal with a doctor who isn't, non-weight centric, or even, asking to be weighed. I hear like all these stories of how sometimes, I don't know if it's on purpose or not, where people are like, okay, just I'll be weighed, but don't tell me the weight, and the nurse will still tell them. And, it can be very triggering. And so it's, a lot of these things, it's just going to take a while, but just know that it's just really a work in progress, and what we're saying is not easy. I just want to make that clear, because any kind of change in the system is never going to be easy, but there are people that will believe you. I'll just say that.
Yeah, absolutely. And when you do feel down, that's value community, right? Is that the reason why you decided to start? Because you're on Instagram talking about all of these things. It's not your main work, which I don't think anyone would know. Just looking at your,
I know. Instagram is like a job.
Like, oh, you're a dietitian working in practice. Like, no, you have a job outside of that. That's kind of different. But did you create that community for that reason? And like, what have you seen as the value of community for those who might be learning, unlearning, also experiencing and dealing with some of those disappointments and frustrations and all of it?
Yeah, definitely. Because I think it's so important, I'm like I mentioned earlier, I had, this was new to me. Like, when I got my dietetic license, and, I was still in the weight kind of mindset too. And it just took learning. It also took, wanting to learn. I'll just put that, because sometimes people won't even want to entertain this conversation. So it also takes an open mind. But it's really interesting. Building a community where people can feel like they can see something and either learn or feel valued, I think is really important, because I'm not able to get to every comment or DM, but I definitely see some of them where it's either, wow, I never thought of this like that before until you mentioned it, or another one is, thank you for saying this, because I don't see this enough. So I think it's just really important to put that out there, and even in my actual 9-to-5 job, just trying to intersect the two, I think is really important. But I think it's nice to have social media. Again, I know it has its downsides, but that's really a place of learning, a place of seeing different aspects, different perspectives. So that's why I continue to do, what I do.
Yeah, that's awesome. And that is so important, is if you haven't found the provider, if you haven't been listened to, it's like, there are communities, and you're right. It's the value of social media, is that there are some communities that are speaking those words and repeating them, which is also important to see it again and again. But then there's also people who are following and engaging that are you, right? They're dealing with the same things. They've had the same struggles. They're also trying to, fight for themselves and advocate for themselves. And there's a lot of value and strength in that, of connecting with people, so that if you are disappointed, or maybe you are, you have been told things that have just really left you defeated, it's like, those are the types of communities that can help, because they're gonna stick together. So I will link Shawna's Instagram, the Nutrition Tea, if you guys want to follow along with her and connect to kind of her community. We'll put that in the show notes. Is there any other way that people can connect, or anything else that you have going on through that initiative?
Yeah, I mean, all my social media is the Nutrition Tea. So anywhere where any social media, I think I'm on. I say that, but you never know. I call myself an elder millennial. I'm always learning these things. So who knows? There might be something I'm missing, but for the most part, the Nutrition Tea, I'm there.
Yeah, that's fair. We can only do so much with so many platforms. I definitely understand that. Well, Thank you so much for your conversation, for the value that you brought to all of this. I know that people found it valuable. And if you are listening and you found this conversation valuable, or maybe you have some questions and you're like, I'm very interested, I'm very curious, I encourage you to check out Shawna's content first and then ask, right? It's like, check out what's already available first, and then reach out.
Answer might be there.
Yeah, it's probably already there. But then reach out and ask, because it's important that we all challenge these things and, are empowered with the tools that we need. So thank you for sharing that, Shawna.
Yes, thank you.